It's a pleasure to introduce Dr. Schmahmann. In all respect, I refer to him as the Magellan of the cerebellum. Susan's the scientist in the family. I'm the history background, and you may remember while the Spanish king sent him to discover the far corners of the earth, he was Portuguese manual. We recognize that. And at that time, he proved that the world is round and not flat, which was the conventional wisdom. And I think you'll see some parallels with Dr. Schmahmann's research in navigating the cerebellum and seeing the connectedness to the other parts of the brain, which we think holds hope for the future for Katie and many others with neurodegenerative diseases. Dr. Timmons, to whom Susan referred at NIH, introduced us to Dr. Schmahmann. She, on her own, went to an ataxia conference of all the great researchers in the area and said, "You've got to meet this guy. He's the rock star," and he said he would meet you and Katie, and so we met him, and that was the start of this journey. She basically said he's among the most creative neurologists in the world. He's an exceptional person, and that's certainly been our experience. To say his credentials are impressive is an understatement. You can see them on the website, but basically he's recognized internationally as an expert on the cerebellum and the anatomy of the brain. He's a full professor of neurology at Harvard Medical School. He's a director of the ataxia unit at the Massachusetts General Hospital, and he runs the research lab for neuroanatomy and cerebellar neurobiology, and his research publications are numerous. In 2000, he received the Norman Gershwin Prize in Behavioral Neurology. In 2006, his book on the anatomical structures and the fiber pathways of the brain won the prize for the best publication in medical science. This book, which has been co-authored, has been described by two of his colleagues as nothing less than a masterpiece and the most important anatomical treatise in the last 3 decades. What's the relevance of the study to the brain's anatomy and to Katie's disease? Well, he's going to talk about that a little bit. I think after you hear his presentation and see the meaningful research that he's carrying on, you'll have an understanding of the hope that we see out there. Dr. Schmahmann, I think, never sleeps. We get emails generally at 1 and 2 in the morning. As I said, he's a professor of medicine. He has a clinical practice of which Katie is a part, and he runs his research lab to boot. What's impressed us is, we think, the multi-dimensions of what he does, makes him great at what he does, and probably most importantly, the compassion that he's shown our daughter, and obviously to all his other patients, I think demonstrates his human empathy that really contributes to his motivation and dedication to his research. So it's with great pleasure that I introduce you to Jeremy Schmahmann.